All righty. Thank you guys so much for joining us on another episode of Extreme Health Radio. This is going to be a fun show. We're going to be talking with Dr. Scott Sherr about hyperbaric oxygen therapy. This is a really interesting subject, and I think it's something that we all need to learn more about. And I'm super excited to have him on. I was doing some research. Gosh, it must have been like 6 months ago. I was doing some research on some of those chambers that you can get on the inside of your house that you can purchase and have at your own home about oxygen and hyperbaric oxygen therapy, and I came across Dr. Scott's work, and so we're going to have him on and talking about all the different benefits and different ways that hyperbaric oxygen therapy can help benefit your life and help improve your life. So this is going to be really cool. This is Extreme Health Radio, and this is episode 587. So if you guys want to grab the show notes, want to grab any of the links to the sponsors, anything like that, just go to extremehealthradio.com/587, and we'll put the show links and all of that there for you. We've got some great shows coming up for you guys. Episode 573 coming up with Dr. Mark Circus. We're going to be talking about magnesium and his really advanced protocols for health. He's an awesome guy out of Brazil. We've had him on the show a couple times, Dr. Mark Circus, as well as Dr. Jack Cruz. I know he's a fan favorite, and I know you guys love him, and I love him too. His work has been instrumental in my health journey. Dr. Jack Cruz will be talking about mitochondria, light, water, magnetism, all that good stuff, all the most important stuff for your health. And then we've got a show all about the immune system. So that's going to be coming up. That's going to be an amazing show, how to boost your immune system. And then we've got Nicholas Pinault, and we talk with him about the coming 5G sort of phenomenon and how this whole 5G is going to affect all of us. And it's coming, my friends, and it's something that we really want to learn mitigation strategies for. And so I just wanted to say before I introduce Dr. Scott that this show is going to be brought to you by the Extreme Health Academy. If you guys haven't checked that out yet, check it out, extremehealthacademy.com. We're doing monthly courses in there. We're doing all kinds of really, really high-level courses and content and workshops and Q&A sessions, and there's a forum. And if you want to take your health to new levels, go to extremehealthacademy.com, and I'll give you a little bit of a coupon code. So if you want to join, if you use the coupon code EHR14, you can get 2 weeks off of your trial. So I highly recommend that, extremehealthacademy.com. Okay, so today we've got Dr. Scott Sherr. I'm looking at Dr. Mark Circus, episode 587, and he's an internal medicine doctor. He's a hyperbaric oxygen therapy doctor. He works with health optimization. He's the director of integrative and hyperbaric medicine and health optimization. Really cool guy. We're super excited to have him on. Let me go ahead and turn his audio on and introduce him. How you doing, Scott?
I'm great, Justin. You can hear me all right?
I can hear you perfect. Yeah, you can hear me okay?
Yeah, we're doing fantastic.
Awesome.
Good morning to you over here on the West Coast. Where are you located, Justin?
We're just south of you guys, down in Southern California in Orange County, so we're not too far.
Episode 587. I love it. It feels good. Thanks for having me.
You're so welcome. You're so welcome. I just was doing some research, like I was saying at the beginning of the show, into hyperbarics, and I stumbled across your talk. I think you gave a talk at what was the name of the location? I think it was somewhere near you, wasn't it? It was an in-person
I know
talk.
Exactly what you're going to say.
What is that place called? I forget.
I am so embarrassed by that talk in so many ways. It's funny because It was the first real lecture I did on hyperbaric medicine in front of an audience, actually.
Oh, wow.
It was 2013 at this place called the Smart Life Forum, which is Silicon Valley Health Institute is another name for it. They have experts usually once a month on Thursdays. And it was my first time getting in front of a big crowd talking about hyperbaric therapy. And I think it's been seen like 40,000 times. And I'm like, oh, God, I wish there was a better one you guys would look at more than that, because I've done just a few, like 100 since then, and I think I've improved greatly with my delivery and my explanations. But yes, that's what you saw.
Man, Scott, that was an awesome lecture. I am sure everyone says that. I mean, we're all critical of ourselves, but you did great. I know.
Oh, well, thanks. Yeah, I was just getting my feet underneath me when it really. I understood hyperbaric medicine, but I didn't really understand how to deliver the message in a way that I think resonated to the audience. And interestingly enough, Justin, I was just invited again yesterday to return to that stage and actually do a lecture next month at the Silicon Valley Health Institute I think August 16th is the date in Palo Alto. That's where it's located. So I'm excited to go back and redeem myself.
Sort of redeem the sins of the past, right?
Well, hilarious. Yeah, I mean, I think iterate on something that I've had a lot more experience with since 2013 and understand the physiology and understand how to deliver the message. So, but anyways, I'm happy you found me through that semi-okay lecture, and we can talk about it today as much as you'd like in any capacity.
Yeah, that's great. I don't know, you've been involved in this for so long, but, I got introduced to this years and years ago, but I haven't really studied it. Like, this is your expertise, and this is what you work with patients in a clinical setting, and you have offices on the East Coast, West Coast, and we had a guy on, you probably heard of him, gosh, what is his name? Ed McCabe, and he wrote that book, Flood Your Body with Oxygen. And I read that years ago. Yeah, it's like a 600-page book, and it's pretty
nice,
instrumental. Yeah, and he talks all about all the different ways of getting oxygen into your body, and he mentioned hyperbaric in there, and it fascinated me. Yeah.
So let's talk about that, because I think how do you get oxygen in your body, right? I mean, so most of us know that we just take a deep breath. We breathe in the air around us, and the air around us only has about 21% oxygen in it at sea level. So if you're at altitude, if you're at like a Mount Everest, for example, you're significantly higher in elevation, and actually there's significantly less oxygen in the air. Do you know the opposite extreme as far as the below sea level equivalent, Justin, by chance?
Yeah, I was listening to some of your lectures last night, and you talked about the whole difference and opposite of going below sea level. I thought it was fascinating.
Yeah. So the Dead Sea is the opposite that I often give, because the Dead Sea is, I think it's about 3,000 feet below sea level, and so you have these opposite extremes. And we know that the Mount Everest ecosystem is actually quite toxic to our body, but the Dead Sea ecosystem, the Dead Sea, has actually been known for thousands of years to be a very healing location. And because actually there's more pressure, and we'll talk about what that means. And so the easiest example to think about is if you're underneath the water. So if you have 20 or 30 feet of seawater above you, so you're swimming, you're scuba diving, not deep sea fishing, because that would be the fish and your pole, not you. And so all that water is exerting a pressure on you, and water is extremely heavy. And so when you're in a pressurized environment, you actually change your body's physiology. And when we're talking about oxygen and delivering oxygen to your body, when you have an extra amount of pressure around you and you breathe in the regular amount of oxygen in the air that's around us, or you even increase the amount of oxygen in the air around you, which we do in a hyperbaric chamber, you drive more oxygen into the body by simple physics. It's basically a gas law. The gas law says the more gas you have circulating around, the more pressure you put on it, the more of that oxygen, the more, in this case, oxygen, the more of that gas is going to get driven into the body itself, into the blood vessels. So we have red blood cells that typically carry oxygen. Red blood cells are the oxygen carrying cell in our body. Increasing our oxygen carrying capacity often is thought of as increasing the number of red blood cells that we have in our body to get oxygen to our tissues. Hyperbaric therapy works a little bit differently. It works by pressurizing the oxygen and getting it into the plasma or the liquid of our blood, which typically doesn't have a lot of oxygen in it already. So we're driving oxygen up to 1,200% or more increased saturation in the plasma of our blood. And that's how oxygen gets in our body using hyperbaric therapy. To sum it up, it's just a combination of oxygen inspired with increased atmospheric pressure around us that allows our physiology to change to drive that oxygen into our system.
So later on, I want to get into more, like all the different sort of aspects of healing that you work with and people you've seen. But so we've got the idea of getting oxygen into the body, right? So why and what is oxygen doing once it's there, and why is it so beneficial to have, and why are we so deficient in it?
Well, I think the first thing I just want to kind of sum up here is that oxygen carrying capacity is extremely important. We need oxygen for our cells to make energy. If our cells do not have oxygen, they don't make energy. And if you're without oxygen for, depending on the person, a couple minutes, maybe 3 minutes tops, you start degenerating tissue without oxygen delivery. And that's why it's so important. If you've ever heard the saying, time is brain or time is heart in the acute setting, that's when somebody has a stroke or a heart attack. The faster you can get the oxygen to that tissue, the faster you can prevent it from dying or degenerating or causing a bunch of inflammatory factors to be released. And all of a sudden you have all this tissue that's degenerating. So once that oxygen gets into circulation in a chamber, you have a couple things that happen. So hyperbaric oxygen therapy, like I said, is a combination of increased inspired oxygen and increased atmospheric pressure. You drive that oxygen in circulation. And basically, I think of it as sort of two buckets. The first bucket is the acute bucket, or immediately what happens when all that oxygen gets into your system. Immediately what's going to happen is that you're going to reoxygenate the system, okay? So think about it like this. So when we have a blood vessel that has oxygen in it, that blood vessel is going to diffuse oxygen outside of it a certain length. Diffusion, like osmosis, where it goes from high concentration to low concentration. If you've flooded the body with oxygen, now you have a significantly larger diffusion capacity. So we talk about this in micron depth, but if we're talking about that, we're talking about from a blood vessel, we're 64 microns to about 164 microns. So we're basically almost tripling the capacity of how far that oxygen can diffuse out of a blood vessel. So if you think about it, if you have a blockage to a blood vessel or an injury to the blood vessel, all of a sudden that the oxygen is not getting any further in the blood vessel itself, but it's diffusing around that blockage. So anything downstream to that blockage is still going to get oxygen, at least more of that tissue will. So you're preventing all the downstream deregulation and inflammatory cytokine hormone release that's going to make the tissue damaged or make the tissue die. So in the acute setting, you're reversing low oxygen states, which is extremely important. You're also acutely decreasing inflammation, and that's done through various pathways. You're also decreasing pain almost immediately, and you're also fighting infection. So if there's infection floating around, you're going to have a high oxygen stimulus. So you can imagine if it's a bacteria, a fungus, a virus that doesn't like high oxygen environments, that oxygen itself is going to cause a direct killing to that organism. So that's how I think about it in the acute setting, decreasing inflammation, reversing low oxygen states, fighting infection. And of course, the last one would be stimulating the release of stem cells from our bone marrow, which is where they're made. Also stem cells in our brain, which is extremely important, as you can imagine. Stem cells regenerate tissue because they're the cells that can go to tissue and make new tissue in that area. So that's in the acute bucket. That's what happens immediately. And in long term, so what happens after a protocol of hyperbaric therapy is that oxygen stimulus actually has an effect on our DNA itself, suppressing and expressing different genes that are responsible for growth, for decreasing inflammation, from preventing cells from dying, and regrowing blood vessels. So new sort of scaffolding of tissue regrows, and the stimulation of healing happens, new cartilage cells, new bone cells, new connective tissue cells, new neurologic cells like neurocells, like glial cells, and even new neurons. Neuroplasticity can happen over a protocol of hyperbaric therapy as a result of that epigenetic change that hyperbaric therapy can actually manifest on the DNA itself.
Dang, that's crazy. So yeah, it's actually happening at the DNA level. So that's more like a long-term anti-aging approach that you're talking about there, the second bucket, right?
Well, that second bucket happens with anybody that's going into a hyperbaric chamber. It just depends on the protocol itself on how actually that's going to manifest. So we have 14 indications, for example, that are covered by Medicare and commercial insurances where hyperbaric therapy will be reimbursable. Things like diabetic foot ulcers, patients that have had radiation exposure from cancer treatment and then have had side effects of the radiation, patients with chronic bone infections, patients with sudden hearing loss. So the funny thing about it, Justin, is that hyperbaric therapy is anti-aging in the sense that it's healing wounds no matter where they are. And it does that acutely, like I said, and then for a protocol, it'll do that by changing how the DNA, is expressing and suppressing different genes, allowing the body to heal from the inside out. So, and that manifests depending on the situation. So somebody that has a diabetic foot ulcer, it's going to heal that foot or help heal that foot synergistically with antibiotics or other wound care. I like to think of hyperbaric therapy as the ultimate synergizer and an accelerator of wound healing. And those wounds happen over time, right? So sometimes they're nasty, acute traumas, like we have a limb that's fallen off and we have to reattach it. Hyperbaric therapy is going to help for that. But if you have a brain that's just degenerated over time, just because of poor diet, not getting outside in the sun, doing the various things that degenerate our body from a toxic exposure perspective over time, then you're going to get slower degeneration of blood vessels everywhere, including the brain. But we can regenerate those blood vessels in the brain. And actually, we have new studies that are showing the before and after effects of a protocol of hyperbaric therapy, angiogenesis, the revascularization of parts of our brain, that you can see these areas of our brain tissue come back to life because of that new blood vascular flow. And now all those nutrients that we're hopefully ingesting from a good diet and various good lifestyle factors now can actually be delivered to these tissues and maintain them for longer periods of time.
Yeah, man, I can see the applications, the practical applications, especially for, concussions and things like that with sports injuries. I'm sure you're seeing a lot of that. Is that, if someone does have a concussion, is that part of what's covered by the mainstream medical model and the insurance companies?
So unfortunately, right now, concussion is not something that's covered. There's a lot of controversy, as you'd imagine, with
Right.
concussion treatment. There is not so much controversy in my field that hyperbaric therapy is a massive stimulus for healing the brain. And in fact, there's been several studies that have been performed over the last several years that have shown that. But the the challenge with hyperbaric therapy is that the placebo effect is difficult to control for. And it's also difficult to have a fully placebo group in a hyperbaric chamber because the pressure changes how you feel in your ears. So if you've ever been on a plane or a train, as soon as you increase or decrease atmospheric pressure, you have a change in your ear pressure. And so making sure that you factor that into your placebo effect, it can be challenging. But what I can tell you is that in my experience and the experience of my colleagues in Israel and my colleagues in Louisiana and also in clinics around the country, we are seeing these patients get better, people that have had concussion symptoms for 3 months or longer. And we do have some pretty good indications that hyperbaric therapy can help in the acute concussive episode as well. There's two things. There was one study that was done in Minnesota back in 2013 that looked at patients with severe concussions, so severe that they had to have holes made in their brains to release the pressure, and they had to be on ventilators and completely sedated. They found that just 3 hyperbaric therapy sessions, the first 3 days once they were in the ICU, decreased their mortality by 50%.
Whoa.
And decreased their disability by about something similar, a little bit less than that. This is just 3 hyperbaric sessions in the first 3 days.
So yeah,
I have a colleague.
I'm sorry,
Go
it must be super important to get those sessions in right at the beginning then.
Well, like I said about time is brain and time is heart in the beginning, It's exactly the same for concussion. I like to think about the brain. I like to think about neurologic hits like this. So if you imagine a still lake, there's no wind. It's perfectly still. You throw a rock in it, there's going to be a direct impact, and then there's going to be ripples around it. If you can imagine a concussion, you have one direct impact, but then you have all these sort of ripple areas around it as the head kind of goes back and forth. And so it's the ripple area where hyperbaric therapy can have its most profound effect. In this case, the direct impact is usually an area of tissue death where we may not have any recovery, because once tissue is dead, it ain't coming back. But all those rippled areas are just stunned. They're just not getting enough blood flow because there's been some microvascular damage. There's just not enough blood flow in those areas to actually heal them. The brain is already working at maximal capacity at all times. It's like a funny thing that we think about, that the brain, we're only using 5% of our brain, but we're actually using our maximal capacity at every one time. What the brain does, it sort of just, it does a division of responsibility. It'll get blood flow where it needs to go to at the time, but it's very difficult to increase the amount of oxygen and blood flow to the brain to heal it. Like For a knee, for example, we can do that if we have a knee injury. For a brain injury, it's really hard. And that's why hyperbaric therapy we think is so important. And I have a colleague just outside of Chicago who's doing acute concussive work on kids and young adults and having significant improvements for just 3 to 5 sessions when they first get the injury. So the short answer to your question, Justin, is yes, absolutely. Time is brain. And because we can heal those areas of the ripples, right? If you think about it, the damaged area is much smaller than the ripples that happen as a result of the damage.
Yeah, it's so fascinating. I'm curious, like in your field and your sort of way of looking at all this, like what aspects do you think, like, are there any frontiers or areas of health that people really need help with that you sort of suspect and you're really excited about looking to see whether or not hyperbaric would work on whatever condition you're thinking about? Are there any areas that you're thinking about that sort of excite you?
So I think it always comes back to the physiology for me, Justin. What are we doing in the chamber? We're decreasing inflammation. We're reversing hypoxia or low oxygen states. We're fighting infection. We're releasing stem cells. And we're regenerating tissue from the inside out as a result of all that. So in my mind, hyperbaric therapy's physiology is relatively universal. I mean, almost every pathophysiological state starts or begins or ends or includes some of that, or some of the need for these kinds of stimulus. But the question really becomes, when is hyperbaric therapy appropriate for a given situation? And that kind of goes into what my practice is, which is an integrative hyperbaric practice that integrates other modalities and other ideas of how to do a holistic approach for a patient. And so I don't often recommend hyperbaric therapy right away for patients, because if they have complex chronic medical illness that hasn't been really understood, if they haven't decided to really take charge of their health. Now, if you have an acute injury, if you immediately injure yourself and you want to supercharge the healing process, hyperbaric therapy is going to do that without any of that other stuff. But if you have a chronic complex medical illness that's been ongoing for some time, or even if you just want to feel better, perform better over the long term, you really want to do a comprehensive approach. And so as I was doing my research and learning more about hyperbaric therapy, much after that Smart Life Forum that you saw, I found that I was starting to do more labs, maybe some genetic assessments, maybe some supplements, and some other ideas of how I can help people. And then I stumbled across a very beautiful and amazing physician. His name is Dr. Ted Atracoso, and Dr. Ted created this program called Health Optimization Medicine. And Health Optimization Medicine was looking at foundational health of cellular energy, production, gut health, immune sensitivity, looking at hormonal health. And he was doing all of that, and he was seeing all these amazing things happen with his patients. They were being more resilient to stress. Some of their illnesses would go away secondarily to just balancing, detoxifying, more of the subtle stuff. And then they would just feel better overall. And then I started learning more about that process and adding it into my own. And I've had this dramatic shift in my patients as I started doing more health optimization medicine work with them, along with hyperbaric therapy, as I see as this sort of ultimate health optimization technology. Now, there are other technologies, and there's tons of practitioners that I refer to as well. I do lots of conducting, I like to say. I conduct patients to my colleague that does cannabis, or my colleague that does neurofeedback, or movement work, or even health coaching. But it's ecosystem that I've created as a result of just being curious about what's available to my patients. So I don't have a specific illness, I would say, that I focus on. I'm like, wow, hyperbaric therapy can really help this. I always go back to the physiology, the pathophysiology, and say, let's start with foundational health first, because that's what's most important for everyone. And then once we start there, then you can build on top of that, growing that patient's ability to be optimized over the long term.
Yeah, that's fascinating. So, you're a medical doctor, and I'm curious, like, how did this happen for you? Because most medical doctors aren't even close to being as open as you are about these things. How did this sort of awakening happen for you?
So it's a good question. Where does it start?
Yeah.
I think if you asked my father, it would be a few minutes after being born.
Okay.
When I was adjusted for the first time. So my dad's a chiropractor, and I grew up very outside the box. In fact, I don't even know if my father knows what a box is. So, and he was sort of, I think of chiropractors as the original functional medicine doctors. These are the guys that were changing people's diets. They were adjusting people and doing things with the spine and doing things with various aspects of our spinal physiology. But that was just almost an excuse to look at the whole picture in some ways. And so, at least for my dad, that's what he did. And I grew up in that environment. But I also realized as I got older, I worked in his office. I collected money at his office. I was very good at that, by the way. But I learned that there were limitations as to what he could do, because the conventional system was so separate from the alternative medical system, as it was called there then. Now it's functional medicine, integrative medicine, you name the name, but there's tons of them. And I realized that there was likely, in my high-minded world view at the time, I was, I think, 18 years old, or maybe I was a little bit older. I think I got through a couple of years of college. And I was like, there's got to be a way to bring these worlds together. There's got to be this bridge, this chasm builder. Could I do that? And I'm like, of course I can. I'm 20 years old. I can do anything I want. I'm invincible. And so I decided I would go to medical school and figure out a way to bridge these worlds together. And it was during medical school that I learned about hyperbaric oxygen therapy in a trauma center, actually, at the University of Maryland in Baltimore. And it was there that I saw patients go into this gigantic chamber in the basement with like crazy diseases like flesh-eating bacteria, carbon monoxide poisoning, soft tissue injuries, and come out of the chamber like massively different. Carbon monoxide patients that were on respirators walk out of the chamber after their treatment. I mean, just crazy stuff. And when I found out it was just two things, oxygen and pressure, I was just kind of blown away, because those are very natural stimuli that we can get in our natural environment if we just go diving, for example, or go to the Dead Sea, or have the opposite effect on altitude at Mount Everest, for example, or even a lesser altitude mountain. So I kind of dove into the research, no pun intended, because hyperbaric therapy physiology is all based on diving. That's how it got its start. Its history is in treating the bends and decompression illness. But I dove in and I realized how much research had been done in this country, but especially outside of this country, and what it could potentially do. And in my estimation at the time, it was like, well, I could do that. I could take this and this could be my bridge. It has 14 things that are covered by insurance. And then it has about 50 or so indications outside of that paradigm where there's significant data to show that it can help. And then I can create an integrative practice around that. And that was back in about 2013 when that Smart Life Forum video came online. And I was just understanding this physiology and just really starting to use it with patients. And now, fast forward 5 years later, I've really started to believe, I believed then, but I know now that hyperbaric therapy is this massive accelerator. It's a massive synergizer. It can really help the body heal from the inside out. But the key, I think, for most people that don't have an acute injury is to look at the bigger picture and understand that, for at least in my practice now, health optimization medicine, which includes a foundational approach to health, is extremely important. I got so excited by it that I actually have started developing that program, Health Optimization Medicine, along with Dr. Ted and some others, into an educational program for doctors and practitioners to use in their own practices as well.
Wow, that's super fascinating. So, as a healthy guy, like, what do you think would be the benefits of someone in terms of just like, you have a whole thing on your site about anti-aging. Like, is it something that you would want to do once a year if you just have relatively no health concerns, you're pretty healthy, and you just want to sort of optimize everything and you want to live a long time and that kind of thing? Mm-hmm. Like, what's the sort of standard protocol that you would offer to someone who wants to do it for those reasons?
Yeah, it's a good question. I think there's a lot that depends, I would say. And the way I would start the question or answer the question would be this. there's different types of hyperbaric chambers. I think you alluded to this a little bit when you first gave my introduction.
Mm-hmm.
You were researching hyperbaric chambers, and it's important to know the difference. There's what's called mild hyperbaric therapy, which is a soft hyperbaric chamber. So it's made of usually like a polyurethane, nylon, stretchy material. These are usually the home chambers. Those chambers go to about 1.3 atmospheres, which is the equivalent of about 23 feet of seawater. They're typically pressurized or compressed with the normal air that we're breathing now, so 21% oxygen. Then you have monoplace chambers, which are the single-person chambers that go to about 3 atmospheres of pressure, which is about 66 feet of seawater. And you have what are called multiplace chambers, which are for multiple people all at the same time. And they can go down to like 12 atmospheres absolute or deeper. And those usually are seen in hospitals like the one I trained in, or in diving centers where people go very, very deep. The monoplace chambers and the multiplace chambers are usually made out of steel. So the multiplace especially are usually made out of usually steel, and they can be pressurized very deep. The monoplace they can be made of steel, or they can be made of a hard acrylic material that is easy to pressurize. The monoplace chambers and the multiplace chambers are not home chambers. They're usually used in facilities because they're usually pressurized either with 100% oxygen, or you breathe 100% oxygen as you are getting the treatment. And so when we're talking about anti-aging, we're talking about performance. It really depends on what your goals are, Justin, right? So I have certain patients that just want an overall health protocol. They want to do everything. They want to have significant physiologic shifts. They want to talk about epigenetic changes like we talked about earlier, expressing and suppressing genes. So to do that, most of the data has been done in Israel, actually. The Israelis have a full anti-aging program there where they take patients at treatment 0 and they do diagnostics then. They go through 60 hyperbaric treatments, and that's done over a 3-month time frame, Monday through Friday with the weekends off. So a significant period of time. And what they do is they do all those diagnostics again at the end. And what they've shown is some of the things that I was telling you already. Massive angiogenesis, or improvement in blood vascular flow in the brain, in the heart, and in the genital region, including the penis, actually. Mm-hmm. There was just a study done on erectile dysfunction and hyperbaric therapy improving erectile dysfunction. And also, along with the angiogenesis, the stem cell release, the decreased inflammatory cascades, overall physiologic shifts for improvement. And what they're doing to show some of this is not only brain imaging, heart imaging, and penile imaging with MRI, interestingly enough, but they're actually having people go on. Have you done a VO2 max test before, Justin?
I have not, no.
So a VO2 max test is checking how much oxygen carrying capacity you have. And this is really important for people that are doing sports or endurance athletes, those that are obviously doing races, right? So what hyperbaric therapy is doing is by regenerating blood vessels or creating new blood vessels around your heart, it can get more oxygen that's in your blood vessels to your heart to maintain its oxygen carrying capacity for longer before lactic acid starts building up and you have that burning sensation that we all get when we're kind of hitting our wall or whatever you want to call it. Your wall doesn't happen as fast because you have all these new blood vessels around your heart collateralizing it. So, and you actually can test this. You can do a VO2 max test before hyperbaric therapy and a VO2 max test after this 60 treatment protocol. And you have a significant improvement in your VO2 max, along with the new blood vessels correlated to that increase in VO2 max. So it's not a short answer to your question. So in people that want long-term benefit, like a full anti-aging kind of protocol, the Israelis are doing 60 treatments. In my experience, at least 20 is a significant stimulus for long-term benefit. But you need to do at least 20 to have those epigenetic changes on the DNA that allow the expression and suppression of various genes and the angiogenesis stimulus to be enough, the new blood vessel stimulus to be enough, so you have the maintenance of that effect. Because remember, we talked about that acute effect of hyperbaric therapy,
right?
The reoxygenation, decrease in inflammation. It also decreases swelling, by the way, in the short term as well. So to get over that sort of threshold, it looks to be at least 20 treatments, but we're not entirely sure at this time. One thing I just want to mention as a corollary to all this is that if you're looking for hyperbaric therapy for, for recovery, for example, or for exercise optimization, there's different protocols for that as well that we're just learning about now. Not only is it an oxygen stimulus getting into the chamber, but it's also the pressure, like we talked about. And so that pressure also pressurizes your blood vessels. It probably makes new easy water. Do you know what easy water is, Justin?
Yeah, that fourth phase of water, right?
Yes. Yeah, it makes more fourth phase of water, and it helps with the pressurization around the blood vessels, so allowing lymphatics and blood vessels to flow better, so you're going to detoxify faster. And so this is significant. I've had patients with toxicities like metals, mold, infection. Hyperbaric therapy is going to help with that detoxification program. Last thing I want to say, because I'm sure you have questions, is that the mild hyperbaric chambers, the ones that only go to 1.3 atmospheres and are compressed with air, you can breathe more oxygen with a nasal cannula, for example. Those, in my estimation, are most likely best for probably exercise recovery and also neurologic related conditions, because the less pressure and less oxygen seems to be better for the brain, the spinal cord, and helping for that lymphatic flow and blood vessel flow, but may not be, at least for now, we don't think it is, enough of a stimulus to improve that overall physiologic shift that I was mentioning. So I think, in my estimation, you use them together, and you have to just know what your goals are, like I was mentioning.
Yeah, because there's such a massive amount of like overall foundational health things happening as a result of using hyperbaric oxygen that, you got to use specific, chambers for whatever goals you have. We have a couple questions here that I want to read, but I wanted to ask you in terms of that 20 session protocol that you were just talking about. Is that something that you stick to, like like how they do in Israel, where they do it 5 days on, 2 days off, or is it 20 sessions spread out over a few months?
So again, it depends on goals. But if we're looking for a physiologic shift that potentially could be maintained for some period of time, depending on the person, then it's Monday through Friday with the weekends off for that 20 session protocol.
I see.
And that's done usually in a hard chamber is what I recommend, not in a soft chamber. But you can potentially modulate the effects in a soft chamber over the long term. Now, I'm not giving anybody specific medical advice. I want to say that, because it really just depends on what their soup looks like before they start. What is their ecosystem? What's their gut look like? What are their vitamins, minerals, cofactors, nutrients, hormones, immune sensitivities? That's the health optimization medicine piece that's, I think, so important. So if somebody comes to me tomorrow and they're like an endurance athlete and they're like, Scott, Dr. Scott, whatever they call me, and they say, I have a race in a year. I want to get ready for it. It's one thing. If they say I have a race in a week or 2 weeks or a month, it's a different thing. If it's somebody that just wants to have an overall benefit to their cognitive abilities, then we can talk about potentially the soft chambers, because there's some data to support that. If they just care about exercise recovery, then we have to think about, okay, if it's just exercise recovery, then maybe the soft chambers would be okay, and we can talk about various ways to do that. So a lot of it just depends on the person, Justin. So I think that where we're all going now is that you can give basic foundational advice and basic foundational programs to almost everybody. And that's what health optimization medicine is so amazing at, because they're looking at all of the things that I mentioned, along with chronobiology, which is circadian rhythms, evolutionary biology, epigenetics. We're looking at mitochondria, the things that Jack Kruse is so great at, which is light, water, and magnetism, light, and more light.
Right.
Really?
Yeah.
And I love that Jack is gotten so deep in understanding how that works, because that stuff is universal. Hyperbaric therapy, even though I think it can be a universal stimulus for good and for optimization, it really needs to be understood from what are our goals and what are we looking to do and what's the ecosystem that we're stimulating with this. Because one of the things I didn't mention, Justin, that's important is that hyperbaric therapy also, the way it works is it's going to be a scary word, but it works with and uses oxidative stress to do it. And so Are you familiar with the word oxidative stress?
Oh,
I'm
yeah.
sure you
Yeah.
are.
I was going to ask you about that.
And,
Yeah.
yeah. And so it's important to define what that is. And oxidative stress is a stress on our body that can be good or it can be bad if there's too much of it. We need oxidative stress. In fact, we use it in various enzymatic reactions in our body to actually produce good things and to maintain our health. But if oxidative stress is in too high a quantity and our body doesn't have the ability to have a reactive antioxidant capacity, then things start degenerating over time. Mm-hmm. So hyperbaric therapy works by causing these reactive oxygen molecules to stimulate the DNA, to change the DNA expression, okay? So if you have a lot of oxidative stress ongoing already, you're going to have to be careful if you don't have the right antioxidant capacity. So what hyperbaric therapy will do over about 3 treatments, so I almost never just recommend one hyperbaric treatment, by the way, is over about 3 treatments, that oxidative stress that it's stimulating will have a reactive antioxidant capacity buildup in the body. And there's some great studies actually that were done and some reviews by Dr. Dom D'Agostino and Angela Poff at the University of Florida. There's a great study or great review article they wrote, really. Part of it's on the ketogenic diet, but the beginning of it is just describing this whole mechanism. Oxidative stress, reactive antioxidant capacity. And so by the 3rd treatment, you're there. That being said, if you have chronic, complex medical illness, you should test this stuff before you get into a chamber, right? Because if you don't have antioxidant capacity, if you don't have B vitamin, if you have B vitamin deficiencies, if you don't have energy, you're going to rev up this whole system, and you're not going to be able to benefit from it. It might actually cause a detriment to the whole system, and you might get worse potentially. So that's why I'm always very careful with clients and my patients. And I have this discussion first. And so another example is the extreme athlete that's always training and overtraining. They have a lot of ongoing oxidative stress. So you can't put them in a deep chamber right away because they will have a significant response that may not be very happy and very helpful for them, especially if they're in season or something like that. So you have to be very careful. And that's why I'm always very personalized about my approach.
Yeah, I hear you. I mean, you got to see people, got to test them before and after and see what their goals are and see what their overall level of health is. For those who don't know that are listening to the show or watching the show live, many people don't know that we're now doing our shows live on Facebook and YouTube. So if you want to join the live show, we're going to be doing them every Monday morning at 9 o'clock a.m. Pacific as well as 10:45 a.m. Pacific. And if we have any guests that are sort of around the world and in different places, if you're up to date with our YouTube and Facebook channels, you'll get notified, hopefully. But we got a question here from Genevieve, and let me see here. This one's from Facebook.
I like questions.
Yeah, she's from our Extreme Health Academy Facebook page, and she says, have you ever worked with someone with this is a weird word. I've never heard this word before. Cogan's syndrome, C-O-G-A-N-S. And she says, I have yet to find someone that is willing to try. It's a rare autoimmune disease. Interesting.
Oh, beautiful Google here, because I've never heard of it either.
I know. It's a weird, strange word.
Recurrent inflammation of the front of the eye, and often with fever, fatigue, and weight loss. So it sounds like it's an autoimmune type of syndrome. Yeah. Okay, interesting. So, Genevieve, thanks for the question. I don't know about your specific autoimmune presentation, but what I can say overall is what hyperbaric therapy is a profound anti-inflammatory. And one of the ways it works is through one of the major regulators of inflammation, which is called TNF-alpha. A lot of the autoimmune drugs for lupus and other autoimmune diseases work on TNF-alpha and decreasing it or trying to dampen down its dysregulation that's caused it to be out of control. So I know that hyperbaric therapy is going to decrease inflammation, but it's likely not going to be the answer to your autoimmune presentation. What I can say in my experience is there's not a lot of data so far in the hyperbaric community for this. I can just say anecdotally, I've had a few patients that have been treated for on-label things like diabetic foot ulcers and radiation injury that have also had rheumatoid arthritis, that have also had lupus, And they've had significant improvements in the chamber because of what I believe is that anti-inflammatory stimulus in the chamber. Although what I have seen is that once that inflammation goes down, hyperbaric therapy is helpful, and their inflammation typically ramps back up over a certain period of time. So with these kinds of issues, Genevieve, I am so passionate at looking at that foundational health. So I talked about health optimization medicine. You can check us out at healthoptimizationmedicine.org, O-R-G, because I really feel like that foundation for yourself. I mean, when you have a lot of inflammation for a long period of time, all your vitamins, minerals, and cofactors get deficient, especially something like glutathione, for example, which is a master antioxidant. So it would be extremely important before you went into a chamber that you looked at your antioxidant levels and you looked at your vitamin levels and your nutrients and maybe even your hormones to try to balance all of that. Because that's the first thing that I would do, regardless of the autoimmune presentation, which still may be there and it may not go away. But in my experience, if you start with the foundation, things will likely get better. Then you can add on other therapies that may be helpful for you. Maybe cold thermogenesis is good. Maybe alternating with heat and infrared sauna. There's lots of other technologies and things we could consider. But I guess I want to just finally sum up and say that hyperbaric therapy would not be a primary therapy for you. It would be a synergistic therapy, maybe one that could accelerate your healing process. But it would be done in very much an integrative perspective. Mm-hmm. All autoimmune presentations really should be looked at, in my opinion, in that way.
Mm-hmm. Yeah, I totally agree. And there's an aspect of healing where you have to sort of get the foundation, like all that stuff that you're saying Dr. Cruz talks about, like just the foundations of your life dialed in. And then you can start going after like acute things like, okay, I'll use this particular protocol for this particular condition. But right. You know, if your whole life is stressed to the max and you're, living just on the edge and you're just stressed and eating bad food, and then you try to do something like hyperbaric oxygen or some other cold thermogenesis, which are all great, but they're so acute that right. it's going to be difficult to sort of undo this whole lifestyle that needs to change. So I totally get what you're saying. On the
same
lifestyle.
Goes with fasting too, by the way, Justin. So I'm a big fan of intermittent fasting, even longer fasts for people. But I don't recommend they do it right away, especially if they have a lot of ongoing inflammation, because it's going to make them feel worse.
Right.
They have to build up their systems from the inside out first before they start doing those kinds of things.
I hear you. Well, I know you got to go, but let me just give one more question here from our
I have a couple more questions. I'm having fun.
Oh, cool. Okay. Lisa Renee says on Facebook, she says, she basically is talking about the price, and she says, this is such a great healing modality, but for a lot of people, this is, it's going to be too much money. And then she says later on, she says big pharma does not want us well, and so, but then she says, she talks about toxic mold exposure for her, and I'm wondering, oxygen, mold exposure. Is there a correlation between these two things? Do you think, and mold exposure and
Well, I guess let me start with the price and the investment, because it is a significant investment. That is true. There are various things at play to try to decrease the cost, but I think, like she also mentioned, there is a lot of incentive for drugs and for interventions that make insurance companies and pharmaceutical companies money. And I mean, I don't want to denigrate it entirely. There's a reason for all of these things. There's a reason for diabetic medications, and there's a reason for blood pressure medications and illness-based practice. There's also a significant need for acute care in a hospital, acute trauma, like I was in a trauma center. So I want to validate all of that. But what I think the system is doing very poorly is wellness. They're treating illness very well in some ways, right? They're treating illness, but they're not really building up wellness. And in my mind, the only way to beat them is to not beat them, but to run in parallel with them and say, this is an alternative. We have another system here. It's called health optimization medicine. It's not illness medicine. We're not treating any of your diseases. You still need to go to your regular doctors for all that, whether it be your functional medicine doctor, your illness medicine nephrologist, or whatever, your cardiologist. But now all we're doing is we have a separate track for you here that is wellness focused, okay? So, and then inside that wellness focus, health optimization medicine health optimization technologies like hyperbaric therapy. So hyperbaric therapy is a significant investment of your time and of your money. However, it's a long-term benefit for you that's going to decrease your need likely for access to that other system. That system is only going to keep you from getting sicker, but it's not going to get you well. Dr. Ted, my mentor and my colleague at Health Optimization Medicine, will often say, just because you're well doesn't mean you're sick. Let me try that again. Just because you're not sick doesn't mean you're well. It just means you're not sick. So that's what we're trying to evolve past, not just not sick, but actually optimized. So the more of us that get involved in this community, the less all this stuff is going to cost over the long term. I promise you that. But there's a lot of people that do not want this to happen, and I agree with that. But I think there is a way, and it's just using a parallel system. And so, on the question of mold, there are some molds that do not like high oxygen environments, and I've had significant success with patients treating patients with mold with other practitioners who specialize in that, along with hyperbaric therapy to help with some of the direct killing of the bugs themselves, along with the inflammatory response that happens once you start kind of getting these bugs out of your system, and along with potentially some targeted antioxidant therapy depending on what their deficiencies are, because that antioxidant capacity is extremely important. So like I was mentioning before, hyperbaric therapy can be a significant stimulus to help patients with mold exposure, but I think that it's best done often in an integrative way with other practitioners that are sort of dealing with the mold itself, hyperbaric therapy helping with the inflammatory response, killing the bugs at the same time. So again, synergistic approaches here. That's really what I'm all about.
Mm-hmm. Yeah, mold exposure is a big deal, as you know. There's also the environmental aspect too, where you got to get that mold out of your house. We've done a few shows on that. Want to just do a quick question here from YouTube. Chaya says, does Dr. Scott have any experience with Down syndrome? Interesting.
So Down syndrome itself, the answer is no. Because Down syndrome is a genetic syndrome. The genetics of Downs are with somebody for their entire life, as you would imagine. Some of the manifestations of Down syndrome would be hypothetically amenable to hyperbaric therapy. I can't actually say that I've had anybody in the chambers with Down syndrome itself, but they are prone to things like Alzheimer's disease earlier in life. And there is some indications that hyperbaric therapy could be used in an integrative protocol again in patients with Alzheimer's. There's a study that they did on animals looking at hyperbaric therapy plus St. John's wort for Alzheimer's, and some significant benefits to the mice. There's also a new study that's being done at Mount Sinai in New York in conjunction with my colleagues in Israel, looking at mild cognitive impairment. And as you can imagine, Justin, that mild cognitive impairment, neurodegeneration, this is all related to everything we're talking about. It's about toxin exposure, it's about infection, it's about unregulated inflammation, it's about our diet, it's about the lack of sunlight, and it's sort of all the confluence of factors is the brain starts degenerating. We know that hyperbaric therapy can regenerate blood vessels. That's a good thing. And so what we're seeing now is with the regeneration of blood vessels, the decrease in inflammation, along with a comprehensive approach, somebody like Dale Bredesen, for example, his work, and others that are looking at Alzheimer's, you can have a significant stimulus at healing the brain. If you just do hyperbaric therapy without the other stuff, you can probably regrow blood vessels, but they probably will just continue to degenerate over a period of time, given you didn't change the underlying ecosystem that allowed the degeneration to happen in the first place. Mm-hmm. I joke with the Israelis, actually, because they're seeing these significant benefits in their patients, and their focus hasn't been diet yet, and or some of the other factors that we're talking about. So they don't know what or how long these effects are going to last. But I mean, it's obvious to me that the effect is going to be longer if you're building the body up from the inside out, rather than just McDonald's hamburgers, new blood vessels, McDonald's hamburgers,
It's like, yeah, totally counterproductive. Grant wants to know, what do you think about having too much copper? He's asking this on YouTube. Too much copper in the brain, which makes your vision and cognitive abilities change. What are your thoughts about that? He said, just to preface, my condition is called visual. Gosh, all these interesting like labels I've never heard before, called visual snow syndrome. That's interesting.
They're getting me too, though, Justin. It's not just you. So they're, but that's, again, I can't comment on the specific syndrome. There are other genetic diseases that are associated with copper deposition in the brain. And all I can really say is that in my experience, I have seen patients that have done well with heavy metal detoxification along with hyperbaric therapy as a stimulus to help with that lymphatic pressurization and getting things to move. We know that the brain has something called glymphatic vessels that are in our brain that help with detoxification, that open up at night, for example. That's why one of the reasons why sleep is so important. So somebody that talks about this a lot, for example, Justin, is Tony Robbins. He'll talk about his experience with mercury toxicity from eating too much tuna.
Oh, wow.
And he did a combination of hyperbaric therapy with a colleague of mine in Australia, along with some other detoxification mechanisms and treatments for complete reversal of that toxicity.
Wow.
And so what I've seen in somebody like Tony and others is they get this cognitive boost because you're getting all that heavy metal out of your brain, and the glymphatics and lymphatic system are getting it out of there. You're detoxifying, which is good. But again, you have to make sure you take away the exposure, and you have to know, in my mind, what's going to be the plan over the long term to maintain that health, if possible. But I mean, heavy metal exposure is nasty. Copper itself is a natural occurring, so I'm not really sure exactly how you would work on that. I think that maybe you'd have to look at various ways of decreasing copper, and then and there's medical treatments for this. And then you can look at how hyperbaric therapy might help with the inflammatory cascade that may get deregulated when you have that leaching of copper out of the system.
Yeah, I hear you. And then copper pipes as well. People in homes exposed to that. We have, there's a doctor on our show who does a lot of his work. You're probably familiar with him, Dr. Lawrence Wilson. We had him on episode 144. So if you guys are interested in the copper issue, you can go to extremehealthradio.com/144. And his whole his whole sort of practice is based on copper. And if you're in the LA area, there's a lady that we go to every so often. Her name is Nikki Moses, and she does this whole copper thing as well. She's been trained under Dr. Wilson. Her website is mosesnutrition.com. And so let me see if there's any other questions here for you. And it looks like
one of the things that you mentioned while you're looking is that hyperbaric oxygen therapy is classified as a drug because we're pressurizing oxygen. And as a result of that, it does require a prescription to get into a chamber. Now, that being said, you could buy one on on like eBay or something like that, and you can get one, a soft chamber. I don't recommend you use it without understanding why. And that being said, I mean, the mild hyperbaric chambers are relatively safe for most people. But if you really want to have, and if you're making the investment, you should really understand why you're making the investment. So I recommend everybody talk to someone that knows about hyperbaric therapy. I do virtual hyperbaric consultations, advocacy, and education around the world, actually, talking to patients, clients, or if I don't know somebody in the area where they live, I often can coordinate with their local providers. I have clinics that I work with in New York. They're called Hyperbaric Medical Solutions. In California, a place called Hyperbaric Medical Services, which is affiliated. Bay Area Hyperbarics, which is in San Jose. And then I have I have colleagues in Oregon, also in a little town called Ashland, Oregon, that have a facility there. And then I have affiliations across the country and the world. So I say this just to give a framework for all of your listeners and viewers that hyperbaric therapy is a safe technology. It's safer than a Tylenol. I promise you it is. And we can go through some of that if you want at the end. But at the same time, it's important to know why you're going in. And there are some risks if you have those, you should know that maybe you shouldn't use hyperbaric therapy, or maybe you should at least talk to a doctor before you just get in one without a prescription, which I never recommend. So
okay, awesome. Hey, Doc, do you want to take some more questions, or I know you've got a busy schedule, so we can do whatever feels good for you, or what do you think?
I got about 5 more minutes. Would it be helpful to go through a couple of the potential cautions for people before they go into a chamber, maybe?
Yeah, I was going to ask you that, and I also sort of selfishly wanted to know why, like some of those home units, are they under some sort of a legal guideline that they have to stick to the 1.3, or
Yeah.
But yeah, I want to talk about
that's the legal
what you were
guideline.
saying. Yeah.
Yeah, so the legal guidelines for home units are 1.3 atmospheres, which is about 23 feet of seawater or 25 feet of seawater,
I see.
Or more shallow, but no
Okay.
deeper than that.
Okay.
Because once you pressurize something deeper than that, then the question of it, especially if you have higher oxygen concentrations, combination of pressure and oxygen is therapeutic, but it also can be flammable. Okay.
Okay.
So that's why you don't really want to go. Some people will modify their chamber to go deeper. I don't recommend you ever modify your chamber. Some of the soft chambers, well, some people will do that, I promise you.
Wow.
And because in other areas of the world, you can go deeper legally at home, but I never recommend you do that because once you start doing that, you start having more issues, and potentially if you don't know what you're doing. So in a chamber, I mentioned that you have a pressure sensation, right? The pressure change in your ears. So you have to be able to decompress your ears like if you were on a plane or a train. If you're not able to do that, the pressure can build up and you can actually burst your tympanic membrane, your eardrum. Now, very uncommon to do that, especially at the more shallow pressures, but the deeper you get, the more risk you have. So something that's very easy to mitigate. Most people can do it with just a couple maneuvers like they would on a plane or a train. 95% of people have no issues. So your ears are important. So, and also your sinuses. If you have any sinus congestion, allergies, if you have fluid in your inner ears, it's going to be difficult to maintain the pressure differential between the inside and outside. Many of you have probably been on a plane or a train with a cold or sinus infection and like the terrible pain you'll get, or mild pain. That's because of all that pressure. You can't decompress your ears. So ears, talk about your sinuses, your eyes. At the deeper pressures, the lens of your eye will change convexity for a little while. So it'll be harder to see far, but easier to see close. So you may not need your reading glasses if you need those. But we counsel people not to change their glasses because it's going to get better within about 14 days to about 3 months after finishing treatment at the depths of like 2.0 or deeper. Other risks, and actually a benefit in some ways, is that hyperbaric therapy is going to improve insulin sensitivity. So your blood sugar will drop in the chamber. So if you're keto, for example, your ketones are going to go up, your glucose is going to go down. That's good. But if you're a diabetic, we have to be careful, as you can imagine. And then other things to just consider, if you have any underlying lung disease, hyperbaric therapy works on the lungs. You take a deep breath in, that air gets diffused into the capillaries in your lungs, and that's how the oxygen gets into their bloodstream. If you have any trouble with your lungs, if you have COPD or restrictive lung disease or fibrosis or any requirements for oxygen, if you have bad sleep apnea that's not controlled by a home unit, all those could be, it could be dangerous to get into a chamber. So I don't recommend it unless you get evaluated. Last thing to mention is oxygen-induced or oxygen toxicity seizures. These can happen at very deep pressures if you have an underlying risk for seizure, basically. But it's very, very rare, and we have ways to mitigate that in the chamber, especially at the deep pressures. At the more shallow pressures, like the mild chambers, there's never been a seizure that's been demonstrated in somebody that didn't have an underlying seizure disorder already. So overall, very, very safe, but you have to know some things before you go in and say, these are my goals, these are my risk factors, maybe I have some, maybe I don't, and then understand what kind of protocol would be best for what your goals are.
Awesome. Okay, cool. A couple really easy questions to answer at the end. One is, where can people find you? And then the second question is, people are listening to this thinking, hey, I live in Maryland, I live in England, I live in California. How do I find one? Are there is there a place that I know is reputable? Is there a database that you recommend? And so how can people go out and find these sort of chambers themselves?
So the database that's out there right now is actually quite outdated, unfortunately.
Bummer.
There's no real money that has been dedicated to doing this or maintaining it. I mean, the good thing is that there are great people in all those locations that you mentioned, and I know them very well. I have some colleagues in London that have a facility there, people all over California. I have colleagues in Maryland, in New York, in Boston. And so I often recommend to find me. I do, like I said, consultations, education, and advocacy. You can find me on the web at integrativehbot.com, the word integrative and the letters hbot.com. You can also find me. I'm the Chief Operating Officer for Health Optimization Medicine, and that's healthoptimizationmedicine.org. And so I think I also have a Facebook page, which is Integrative HBOT, and a Twitter page that's at Dr. Sherr, DRSHERR, although I'm not very regular about the whole tweeting thing. But the Facebook and the website, you'll find a ton of research on hyperbaric medicine. I work very closely with my New York colleagues at Hyperbaric Medical Solutions, specifically where we house all the data. So you get a lot of good data there. And so I would say to find a reputable source, the things that you want to look at if you don't want to contact me directly is you want to make sure that that you're evaluated by somebody that knows something about hyperbaric medicine. So either a physician or physician assistant, a nurse practitioner, somebody that knows something, and you have a prescription to go in the chamber. You should really not get in a chamber without a prescription, in my opinion. I'm a doctor. I guess I'm biased, but and as far as other things, you want to know what kind of chambers they're using and what kind of safety protocols they have. So if it's a mild chamber, again, pretty safe. But if it's a monoplace chamber, which is the hard chamber, or the multiplace, you want to make sure that they have safety protocols in place that you're going to be safe if there were an emergency. And you can ask about these things. What are you going to do if there's a fire? What if you're going to do if there's a loss of electricity, right? What are you going to do if I have a problem? Are you going to always be next to the chamber, or are you going to leave the room and I'm going to be by myself? These are things that I ask all of the clinics that I coordinate with. And I'll only recommend those that have at least the basic stuff in place. And all the clinics that I work with directly, Oregon, California, New York, we have physicians, we have physicians assistants, we have certified technologies that are also ACLS trained, which is advanced cardiac life support and basic life support training. So it's very important to know what you're getting into. And so that's why I don't like patients and clients or people. I don't like anybody really buying chambers on eBay and just getting in them without having any understanding of this stuff, if possible.
Yeah. Yeah, especially, like you said, eBay. I mean, gosh, who knows what modifications the person you are buying it from did to it, so.
Absolutely, yeah.
All right, Doc. Well, thanks for your time. I want to be, aware of your time. So thanks for being patient with us today at the beginning of the show.
All good.
Late. Yeah, thank you very much. And so it's integrativehbot.com would be the place for people to find you. Is that right?
I think that's the most primary direct way is either to put in my name into Google, Scott Sherr, Sherr, MD, and you'll see a lot of the media that I've done and other podcasts and everything, especially that smart forum thing. I'm going to replace it though with this new one, I promise. And awesome. And also integrativehbot.com and my Facebook page of the same name.
Awesome. Cool. All right, Doc. Well, we're going to cut off and appreciate your time. I'll be in touch as soon as the link goes live, and I'll send you the YouTube link and all that good stuff. So thanks for your time today, my friend.
Awesome, Justin. Have a nice day.
Awesome. Thanks. You too. Bye-bye. All right. So episode 587 is in the books. What do you guys think about hyperbaric oxygen therapy? Would you ever do it? Have you ever done it? I'm curious. Comment below. I'd love to know what your thoughts are. Just to let you know, our shows are going to be live now, and we're super excited about that. But let me go ahead and show you some of the different things that this is good for. So I'm just sort of reading off of his website, and let me show you real quick. His website says, let's see here, looking right here at his website, how oxygen works. Okay, here we go. So I'm not sure, this is hyperbaricmedicalsolutions.com. And so like he said at the beginning, it's got some on-label conditions that are FDA approved, like gangrene, necrotic tissue, non-healing wounds, severe anemia. That's interesting. Radiation damage, I'm guessing from like chemotherapy and things like that. Decompression sickness, diabetic extremity wounds, skin grafts and flaps that haven't healed sort of correctly, embolism, carbon monoxide poisoning, inhalation, stuff like that. And that makes sense. But here's some of the sort of non-approved things that this would be good for, like anoxic brain injuries. So I'm thinking concussions, arthritis, cancer, cerebral palsy, chronic fatigue syndrome, chronic pain, complex regional pain syndrome, concussion and traumatic brain injuries, obviously, Crohn's disease, fibromyalgia, inflammatory bowel disease, interstitial cystitis, Lyme disease, migraine headaches, multiple sclerosis, retinitis pigmentosa, pancreatitis, spinal cord injuries, sports injuries, stroke, surgery preparation. Now this is interesting. Surgery preparation and accelerated recovery. Complications of scleroderma and ulcerative colitis. So those are all sort of treatments that you might want to look into. If you have any of those treatments, you might want to look at Hyperbaric Medical Solutions, because, you know, in today's world, it's fascinating how there's such an issue with the onslaught of our health, just from our lifestyle, right? Like we've got 5G coming, we've got all these environmental toxins, and, you know, they're doing studies of umbilical cord blood from newborn babies already containing over 200 different chemicals and known toxins that the mother's exposed to during pregnancy. And this is like, it's just crazy. It's absolutely crazy. So we have so many options of healing in our world today. So that's what I like. Speaking of that, I wanted to share with you, our Relax Far Infrared Sauna. Now, this is a really fascinating healing modality that I recommend to everybody. And we've had ours for, must be 6-7 years now. And we've used it just about every single day. In fact, sometimes it's like 7 days a week. And this is the Relax Far Infrared Sauna, which releases far infrared light, so it's invisible to the eye, but inside the sauna you have these light frequencies bouncing around the inside silver threaded component of the outside of the inside of the sauna. And I tell you, man, you get into this thing, you will sweat like you wouldn't believe. What's cool about it too is that it's very low EMF, so there's a little bit of EMF that comes all the way just up to the bottom of the chair, and very, very low. I've used mine every day for 7 years, and what I love about it mostly is that it allows you to turn it on, and there's no preheating required. So that's one of the main issues with saunas. Like you have to preheat it for 30 minutes before you can get into it, and that uses energy and it costs money to preheat, and that all adds up. And what's cool about this sauna too is that it uses far infrared light, which is, in my opinion, the most ideal form of light to use when you're trying to get deep into the bones and really, really sweat out toxins from your fat cells. And it's portable too, so you can let friends borrow it, or so it's incredible for the human body. So I highly recommend sauna therapy, and I do it every single day. The next thing on the list for me to do is some cold thermogenesis, and go from cold thermogenesis to ice baths to this sauna therapy, and go back and forth. It really puts this incredible stress on the body that's a healthy stress. And I just love this thing. So if you guys want to check out the Relax Far Infrared Sauna, there's a bunch of videos on our sauna page, and you can learn more about it. And it's just really an incredible healing tool to have. And the other thing I want to tell you about is, if you haven't checked out our store lately, we're trying to add products all the time, but like these orange glasses that I'm wearing, those are in our store. Incredibly important to block blue light from your eyes and hitting your eyes. And I talk more about that in the Academy. We have the MitoLife, which is now Symbiotica, the DHA. We've got the air purifier. We got the IMRS 2000 PEMF pad. I lay on that every single night for 16 minutes while I do red light therapy, which is another tool we're going to have in our store very, very soon. Really, really liking this new light therapy that I've been doing. We've got the chili pad, which is a really cool kind of thing you put on your bed to cool your sleeping environment down, and so that way you can sleep in the hot summer months, and it's cooling to lay on this pad. It fills with water, and it's just awesome. We've got the Magnetico mattress pad, which is another tool we have that it's one of the best ways to mitigate 5G, in my opinion, and EMF radiation is actually sleeping in a magnetic field. which is incredible. And we also use the Scalar Energy Rest Shield that's in our store. It's a pyramid that emits a scalar frequency that Ken Rolla has developed and worked with. And so we've got everything from rapid release to Soul CBD oils, which we really recommend. It's just some really awesome products. The Vitalizer Plus, some really great tools to help you in your healing journey. So if you haven't checked out our store, make sure to check that out. But yeah, what did you think about Dr. Sherr, Dr. Scott? Love that guy. That's one of the things that we are so passionate about, is sharing tools and sharing ideas and information that you're not going to get from mainstream media. Like, the news isn't going to tell you that you can heal by yourself using alternative practices like hyperbaric oxygen therapy. So what's really cool about this is that, because the media has it's sort of breaking apart a little bit. Like, we're not sort of beholden to, NBC, CBS, and Fox News, and 4 channels to get all of our information. We're getting our information from multiple sources, online and on the traditional TV, if you still watch that. So what's awesome is people empowering themselves by listening to podcasts like this. I mean, there's a lot of great podcasts out there, and I advocate listening to them, because you're not going to be sort of controlled by, the media, the mass media, and the pharmaceutical drug ads and all of that kind of stuff. So, you never know. I mean, you could listen to a podcast literally, and as a result of listening to that podcast, whether it's this one or another one, you might get some sort of information that could literally save your life, which is just incredible, right? Because, I mean, just the ability for information to get out these days is just so amazing. And I'm just so happy that that's the case now. You don't have to go to a library anymore and figure this stuff out. It's really cool. So I hope you guys enjoyed that show. Like I said during the show, we're going to be doing shows every Monday at 9 a.m. Pacific time, as well as 10:45 a.m. Pacific time. And we're going to do them back-to-back on Mondays. They'll be live, so they'll be on our Extreme Health Academy Facebook page and our Extreme Health Radio YouTube page. So if you haven't subscribed to those 2 places, I would recommend you do that, so that you'll be notified when we go live, and we'll do our best to sort of answer questions and all that kind of good stuff. So hopefully you guys enjoyed that show. I think what we'll do is we'll do questions at the end of the show, more towards the end. And so that way we can sort of get through a lot of the main points that any of our guests want to talk about. And then at the end, we'll answer questions. But I did want to let you guys know too about the Extreme Health Academy. Let me bring that up for you and tell you a little bit more about what that is. What are we doing at the Extreme Health Academy? And the Extreme Health Academy is sort of it's my passion, something that I've been wanting to do since the beginning, back in 2003. I really wanted to create a community of people that are super into healthy living. So that's people that are either trying to overcome a health condition, or just can't seem to find that one thing that's going to help them get over the hump of whatever that health challenge is. But then also, people like you and me, I want to live till I'm 150. I mean, how awesome would it be to have cutting edge knowledge to be able to implement into your life, so that when you're 110 years old, you're like you're 60. Like, that would just be amazing, right? So the way we do that is through education and inspiration, but education first. Education always has to come first, because like Jim Rohn said, if you're inspired and you inspire a bunch of idiots, now you got a bunch of inspired idiots. But that's why education is number one. So that's what we're doing at the Extreme Health Academy. So if you look at some of our courses, we've got the Roadmap to Health, which is a place for you to go and get the foundational elements of your health dialed in. We've got Q&A questions that you can ask your health questions to with Dr. John Bergman, myself, Michael Bergman, my wife Kate, who's also on this show. And we've got courses every single month. And we're going to be branching out as well as doing workshops, live workshops and live Q&A sessions, answering your health questions with other practitioners other than Dr. Bergman as well. And my favorite part of the website is the community. That's where we all come together. We share what's working for us, what's not working for us, and it's really, really awesome. So you can see right here, people are talking about, nuclear stress tests. Their blood pressure was lowered in 2 days. Someone has a question about DHEA. So this person here is starting a 100% carnivore diet for 30 days, and he's going to be documenting how this affects him. 100% carnivore. So someone else asked about triple negative breast cancer. I weighed in on hyperbaric oxygen therapy, Down syndrome, as well as gout and light therapy. So this is a place where, like, if you know a lot about health, man, you could really come in and help other people. And there's such incredible power to that, in my opinion, to be able to come together as a community and share out of love what's working for you and what hasn't worked. And that's how we speed up the healing process, so we can sort of cut out the things that don't work for us. And so we just released a course about healing cancer naturally. This is an awesome course by Dr. John Bergman. So if you go to the course, it's cool. You can go in there and you have the entire course. So like, this is his least, this only has 13 videos. And so a lot of them have like 30 videos. So but still it's 2 hours and 4 minutes long, all with like understanding the natural cures of cancer, and what cancer is, and how to recognize different therapies, and how to heal after toxic therapies, and the role of the nervous system, regular exercise, deep sleep, all of these things. We talk about the link between stress and cancer, and all of that. So you can sit there literally and just watch the entire course, one video after another, which is really great. And so we've got courses on autoimmunity. Let's see, let me go back to our courses section here if you guys want to take a look. The autoimmune course is actually, that one's coming in August of 2018. We've got Building Invincible Immunity course, Balancing Your Hormones course, How to Mitigate the 3 Stressors in Your Life course, Your Nervous System course, the complete course on digestion. We've got a yoga course, and as well the foundation of getting the healing process started course. And these are all courses that are released every single month. And we do challenges every single month where we give away prizes. We do Q&A calls. You can see here, if you're watching on YouTube, we answer your health questions. We cover 24 questions that you guys get to ask. And this is just an awesome place, man. I'm really excited about all the different types of content and videos and things we're going to be putting in here. So if you guys want, I will give you a code, and you can check it out for free. It'll be a 14-day trial. It'll be a 14-day trial, and if you use the code EHR14, you'll be able to get a 14-day trial of our course. And let's go to the mastermind Q&A calls. That happens every single month. We might start doing those twice a month, actually. And the mastermind Q&As where we answer your health questions. So we've got 7 or 8 calls with Dr. Richard Massey and Meridian Grace. We've got a health questions A to Z, so you can go in there and find out what your condition is, and hear us talking about your condition in depth. So we all bring sort of different angles and aspects to healing, right? So even though I am not a doctor, I've been involved in natural healing in a full-time way since 2003. Experimentally, myself, practicing and trying new protocols on myself, as well as researching and learning as much as I possibly can. And I've been doing this radio show for the last 6 years. And I've talked to, hundreds and hundreds of people, listening to probably over 2,000-3,000 different podcasts and interviews and things like that on natural health. So I've learned a couple things. I wouldn't say I'm an expert, but I've learned a couple things. And so it's where we answer your questions. And then the community is just really cool. We've got, almost 1,000 people in this here so far, and people talking and sharing. And it's just, man, I'm just really humbled to be a part of this, so it's really cool. I'm really excited about it. So if you guys want to check out the Extreme Health Academy, you can go to extremehealthacademy.com, and you can check that out, and give it a free 14-day trial. And if you like it, you can continue, and there you go. And that will help you speed up the healing process. You'll be able to make friends and share ideas and get inspiration to continue on your health journey. It's just awesome. So anyway, love you guys so much. Let me give you the show notes again to this particular show page so I can get make sure that you have this correctly. So it is extremehealthradio.com/587. So if you go there, I will put links to all of the things that we talked about on today's show. Extremehealthradio.com/587. So that's all you got to remember, 587, and you'll be able to get the show notes for this particular show. So hopefully that helped inspire you, and hopefully that opened your eyes to a different form of healing modality that you haven't been exposed to yet, and that gives you some ideas. So if you're currently dealing with anything that could be helped by hyperbaric oxygen, now you have a resource and you can go check it out and hopefully find that healing that you're looking for. So anyway, love you guys so much. You guys are amazing. I'm so happy that you are a part of what we're doing. It just makes me feel so good. And yeah, thank you guys for being a part of what we're doing. We love you all, and we'll catch you guys on the next episode.
Is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent any disease or condition. While information in this blog is discussed in the context of numerous conditions, it can be dangerous to take action based on any information in this blog or to start any health program without first consulting a health professional. The content found here is for informational purposes only and is in no way intended as medical advice, as a substitute for medical counseling, or as a treatment/cure for any disease or health condition, and nor should it be continued as such. Always work with a qualified healthcare professional before making any changes to your diet, prescription drug use, lifestyle, or exercise activities. This information is provided as is, and the reader/viewer assumes all risks from the use, non-use, or misuse of this information.